to Extra Depth on COVID-19 variants. Joining us live is ABC7 medical contributor and infectious disease expert Dr. Ogachika Alozie from Sunset ID Care.
Dr. Alozie, we interviewed you live on ABC7 at 10 about a month ago, also about the Delta variant. Back then, the CDC said it accounted for about 10% of new COVID cases in the U.S. Well, the agency just said yesterday that the Delta variant now accounts for 51% of new infections in the country.
Meanwhile, the World Health Organization classified the Lambda COVID variant as a strain of interest. It's circulating at high rates in South America. It's hitting Peru hard right now. Dr. Alozie, should our viewers be worried about these variants?
It all depends on what you define as worry. I think they should keep track of them just like you would in a GPS. But I think it's really important for people not to sort of get bogged down with the constant fear and anxiety that all this news has. One of the important things really is that in our community, we've done an amazing job getting people vaccinated. And so there aren't really a lot of people left that have not either gotten natural immunity or vaccine-mediated immunity.
And yesterday, ABC7 reported there has been an increase in the positivity rate in El Paso County, and we have some more specifics. So back on June 7th, the positivity rate was 0.53%. That's the average percentage of people who had tested positive within a week-long period. Now, the latest data from yesterday shows the positivity rate is now at 5.21%. That's an increase of 883% in just a month. And El Paso has seen an increase of coronavirus hospitalizations in just the past few days. Back on June 26th, 39 people were in the hospital due to COVID. As of yesterday, there are 51, and that is a 30% increase in just 10 days. So, Dr. Alozie, how do you interpret this data? Is El Paso going to have another wave of the virus and an increase in hospitalizations due to variants?
Yeah, we have every expectation that there will be an increase. I don't like the word surge anymore, though, right? I mean, when we think of surge, we think of the trauma that this community went through in November. We're at our peak. We had almost 2,700 infections in one day. What really has to be focused on is the reality that over 95% of the people that are in the hospital today are unvaccinated, and many of them are younger. So I think, again, if the question continues to be variants, the answer continues to be vaccines. We know the vaccines work, especially the mRNA vaccines, and we're really need to focus on those.
And of course, at that time that we had that surge, 0% of the population was vaccinated because they weren't out yet. Let's now take a look at the vaccination rate in El Paso County. As Dr. Alozie has been talking about, city data shows nearly 66% of the eligible population is fully vaccinated. 76% is partially vaccinated. So, Dr. Alozie, are these good numbers when you compare them to other U.S. cities? And could variants threaten our progress, given these numbers?
Yeah, you're going to hear a lot of people across the country expect a surge in the fall. I think what's important to understand is that just like with buying a house, it's location, location, location. We're in a good neighborhood. And those numbers that you just mentioned, Eric, protect us. And that doesn't account for people that have already had immunity because they just got COVID, people like me, and potentially got a vaccine. I was actually talking to my daughter before I came in and said, hey, how can I explain this to people? And it's kind of like dodgeball. Think about it as viral dodgeball. When you're in the beginning of a dodgeball game, you can throw a ball and hit anybody. That's getting vaccinated or that's getting the infection. But right now, there's so many people left, few people left in the game, it's going to be really hard to get that infection, especially if you're vaccinated or you've had COVID.
That's a good way to put it. Now, during yesterday's City Council meeting, El Paso Health Authority Dr. Carranza reported that no cases of the Delta variant have been found here. This is the data that you see here that the city showed during that council meeting. 55 cases of the UK variant, 10 and 9 cases of separate California variants, 2 of the Brazilian variant, and 0 of the South African and India variant. The India strain is that Delta variant.
Take a look at this graphic. It shows R0 numbers, which is a mathematical term that indicates how contagious infections are. The higher the RO number, the more infectious it is. The original virus is the Wuhan, which was up to 2.6%. That caused Europe's first wave. It was 3. The Alpha variant is between 4 and 5, and the Delta variant is between 5 and 8. Dr. Alozie, is there a limit to how contagious the virus is as it mutates? Can COVID become more dangerous in the future?
Yeah, actually, we expect that the virus only has a few more places to mutate into that will actually make it more infectious. Eventually, it loses its ability to replicate, or what's called viral fitness. Again, I think it's important, as you talked about, those percentages. And one graph we didn't show is the drastic reduction that we've seen from November till now, driven mostly by vaccinations and people that got infection. We don't have a lot of people that are able to get infection, and we need to focus on those individuals going into the fall. I don't expect us to have a surge. We'll have some increases, but I think the key word is this: decoupling. Those cases will not be coupled with hospitalizations, and I think that's critically important.
Dr. Okechika-Alozie, thank you for your perspective. Again, that is our ABC7 medical contributor. And now let's send things over to ABC7 Chief Meteorologist, Dr. Dave Spielman. Dave.